Well, it's a few minutes before our start time at 4:30, but I think I'm going to start with just the introductions of who's on this webinar around leadership in crisis. We have a hard stop no later than 5:30. We're back to back in webinars, so we'll get started with content right about 4:30 when everyone has joined. So I'm Wendy Nelson. I'm a senior fellow at IHPME, and I'm an established healthcare leader who I guess I've been in the field for about 35, almost 40 years. And I am an alumni of the MHSC program. And currently, my major playground is Vernissage Health, a leadership development initiative for IHPME graduate students and alumni. Joining today is Dr. Izzer Dubinsky, also a senior fellow with IHPME. Izzer is the former chief of emergency medicine at North York General Hospital, where we met years ago, and he was also chief of emergency at University Health Network. Izzer has 15 years experience in healthcare consulting as well. Dr. Dubinsky is my partner in crime. He is also a project co-lead in Vernissage Health since 2018. As well, presenting today is our Linda Rucco. Our Linda is a PhD candidate in the Department of Surgery, St. Michael's Hospital within Unity Health and IHPME. Her research interests include leadership and capacity building. And our Linda is an alum of Vernissage Health in 2019. Joining us today, but not on this slide, is Jennifer Gutberg. Jennifer is also a PhD candidate at IHPME. Her research examines health system transformation across acute and primary care sectors, and she has a particular passion for studying leadership, organizational culture, and patient safety. Jennifer also is an alumni of Vernissage Health in 2018. And Jennifer is going to monitor the chat today, and then she will also be facilitating the question and answer at the end. And we hope to leave about 20 minutes at the end for that. I want to give one shout out, a VIP listener, and that is Malcolm Moffat. Malcolm is a colleague, senior fellow at IHPME, and serves as executive in residence for the MHSC program. And Malcolm is also co-lead in Vernissage Health, and he's going to be our eyes and ears and give us some feedback how we did. So just a couple of housekeeping things before we start. First, I'd like to welcome everyone and thank you for joining us for this hour. We have over 200 people registered, and looking quickly through the list, I see a lot of alum from Vernissage Health, which has been happening for the past 5 years. So it was great to see all your names. So shout out to you. And our participants come from both IHPME and Rotman School of Management, because we also offer this to Rotman. So welcome to everyone, and thanks for joining. Because we're such a large webinar, everything is muted, so please use the chat to right now start to say hi to one another. I just saw a hi. So you can introduce yourself using the chat. And certainly Jennifer will be monitoring for questions from the chat as well. We are recording this session, so I know a few folks were joining late or having to leave early, so the recording will be available. And as I say, we have a hard stop at 5:30. We've got a quick 3 or 4 question survey, and that will go out to everyone right at 5:30. So please, we'd welcome your input, and please take a moment at the end to fill out the survey. I think that is it for housekeeping, unless Jennifer, have I missed anything from your end?
Not at all. The only thing I was going to say, and I was actually typing it in the chat, I would encourage everyone, feel free to drop a quick little introduction of yourselves into the chat. As Wendy said, if you're a Vernissage alum, let us know what year. And I also wanted to say that as you feel free to drop questions in throughout the whole presentation. But if for whatever reason, let's keep the conversation going. It's hard to be interactive without the cameras and the faces, but if someone wants to answer someone else's question, it doesn't only have to be answered by the panelists. So let's get a nice dialogue going.
Thanks a lot. Yeah, very much so. So, it's the 1 year anniversary of the beginning of COVID-19, and it's also the 10-year anniversary of the tsunami in Japan, and that's been picked up by the media. And yesterday I was listening to some stories about recovery from crisis as told by children who survived the tsunami. And I was really struck when they talked about their first signs of recovery were regaining their ability to smile and to begin to laugh again. So I thought we would start this webinar with a few quick slides, some of my favorite cartoons from the New Yorker during COVID that can help us smile on at our situation. So the first is I think we're all eager to get out and play, particularly off leash if possible, and certainly this week as the weather turns nicer. The next cartoon talks about we've just found there are just some things that you can't do virtually. And the final slide is our desperation really to get back to normal, not have to monitor things minute to minute, hour by hour, and a chance to really just give our brains a rest. All right, so we'll get started. We've had crises before, and they're a time of great opportunity and also a bit of peril for leaders. SARS was a crisis too, followed by MERS, Ebola, H1N1. So, as someone told me yesterday, this is not your first rodeo. However, none of these were as long, deep, or profound as COVID-19, but they were nonetheless a good practice run. So when COVID began, we established leaders began to reminisce and ask ourselves, what did we learn from those experiences that we can bring forward? And lack of leadership in the system was leveled as a major criticism in the Naylor report about SARS. So we began to ask ourselves, if leaders were not up to the challenge then, are we now? So the next slide. I just threw this next slide in there because I'm watching too much Stanley Tucci and the food of Italy. So, what did we do? We began to revisit, as I say, our own experiences as leaders during past crises. And last March and April, as part of Vernissage Health, we had some special sessions where we listened deeply to the stories told by our emerging leaders about their experiences and observations during the beginning wave one of COVID-19. Simultaneously, we conducted a literature search about leadership in crisis to answer the questions, what do we do as leaders during a crisis? What is our main purpose and function? And how can we execute these functions more effectively? And finally, we conducted a survey to capture the observations of you, emerging leaders, more formally about your own practices and how you observed other leaders in the system. So let's start at the beginning. What is the definition of leadership in the next slide? So, leadership is the art of mobilizing others to want to struggle for shared aspirations. And I love this definition, and I think Tina uses it in the MHSC program as well as Christine Shea. A crisis is actually a wonderful opportunity to practice leadership. What's the saying? Never let a good crisis go by, because people really are eager to mobilize and to struggle and work together to get out of a crisis situation or prevent a crisis from deepening. So, in the literature, we identified the next slide 4 critical functions of leaders during a crisis. And I'm going to quickly review these 4 functions. The next slide will talk about what they might look like on the ground and how they're different from normal times, if you will. So our survey put out these functions, and then we asked, are you seeing some of these activities associated with these functions in your daily practice, and are you observing these functions in other leaders in your organization? So the first function is addressing the fears and encouraging resolve of everyone to come together to overcome the crisis. So some of the activities we might see here relate to assisting the staff, physicians, our patients, clients, and the diverse needs of the public to understand just what is happening and communicate known evidence and what is currently unknown, as well as dispelling misinformation or rumors that abound during these times. But mainly, it's showing, demonstrating, invoking confidence, showing optimism that we can work together and we can overcome this situation. The second function is delegation and giving people a purpose in a role to perform during the crisis. We all have an innate desire to do our part, do something to help. And we saw that in the community, people helping neighbors. So in a healthcare context, it would be organizing the work in such a way to meet urgent demands, assigning, reassigning people to perform expanded roles, new roles, monitoring the extent to which the organization is able to meet its demand, measuring what's happening, and altering work routines if required. So that's the function of delegation and giving people purpose. The third function is, and this is the one I love, this is the fun part for me of a crisis, it's encouraging people to experiment, to learn, to try new things in the face of uncertainty. This is the time, a crisis is a time to think out of the box, break the rules, do the things one only dreamed of doing but never had an opportunity to try, within reason, of course. Some activities leaders can do, encouraging teams and individuals to bring forward their ideas, to find new ways of working together, and then allowing them, more than allowing them, encouraging them to try new ways of working. It means embracing new technologies such as virtual care, remote and online working, and really to champion the implementation of new technologies. And last, being open and supporting the failures that are going to happen in this activity, making learning the focus and bringing forward optimism. If it didn't work once, we try something else, try and try again, and set aside our own self-criticisms and criticisms of others in the face of experimentation. And the last function is probably the most important, and that's attending to emotions and taking care of ourselves and the other people that we work with and that we live with. Attending to the fear, the anxiety when our world has fallen apart and everything is different. Paying attention in ourselves and others for signs of illness, stress, burnout, monitoring our work hours. We'll talk about that later. Making it easier for people to exercise self-care. So things like COVID testing, occupational health, EAP, hugely important. Role modeling our that good self-care ourselves. So taking care of ourselves and encouraging others to do the same, making it okay. And intervening in a supportive way when individuals or team need our help. And there are so many people right now that are facing mental health issues and having situations themselves or within their family or within work, and intervening in a supportive way to get people health and care. So just quickly, the last slide. So how does this next slide talks about on the ground? What does normal time, and I kind of don't like that term, but we'll use it, normal time versus crisis leadership look like? So in normal times, we might be following a strict strategy, a strategic plan. People talk about vision. In an emergency, we sort of go on hold, which means we suspend or put aside this strategy or vision to take stock, assess what's happening during a crisis, and then acting with urgency, always ready to change course, adapt, constant updating, because there really is no path, no course to follow. That's just the way it is in a crisis. A lot of what's different relates to communication. And that's the area where, as leaders, we need to change maybe the most. And there are three items on this list that talk around communication: being transparent, sharing freely what we know, what we don't know, what's under discussion, rather than downplaying the threats or withholding of bad news. Exercising 360 communication, talking to everybody and often, rather than following kind of the protocols or cascade communication that we see sometimes during normal times. And moving from a formal way of communicating to more empathic communications. As leaders, learning to see and to speak through the eyes of others, knowing ahead of time what their fears and questions and anxieties might be, and be able to communicate to to comfort. And last, rather than coloring in the lines where leadership is equated with our title or the box we have on an organizational chart, crises is a time to let everyone lead. And in my experience, if we practice this thing called distributed leadership, people rise to the challenge and they can be one of the most productive times. So the question is, did we see these four functions in action during COVID-19? I'm going to turn it to our Linda now to tell us what you observe, because these are your observations about yourself as a leader and the leadership activities of others that are surrounding you. So over to you, our Linda.
Thank you, Wendy. So as Wendy mentioned, the objective that we had with our survey was to assess essentially the performance of these four different functions and their related activities through the lens of the emerging leader. So what we did is we sent out a survey. Next slide, please. And the survey had a number of items focused around demographics, so trying to understand the population who was answering the survey. A number of question items around the extent of engagement with these particular practices, which is what I will focus on in the next couple of slides. And we also asked emerging leaders about barriers, enablers, and any advice that they had in terms of how we could operationalize these practices in our day-to-day work. And we did 2 rounds of our survey. One was sent out during wave 1 of the pandemic. So that was around June and July 2020. And a second round of the survey went out during wave 2 in October and November 2020. So in wave 1, we saw that we had a 33% response rate, with the majority of the respondents being students within health administration or the MBA Rotman program. A large majority of the respondents worked in management. So for example, they could have been employed in a team lead or a manager role, and 20% were working on the front lines of the pandemic. About 1 in 3 survey respondents were working in the acute care hospital setting at the time, with 20% working in a government ministry or agency. So what we saw, so I know the slide is busy, but I will break it down. So first of all, we were interested in the extent of engagement in these practices among emerging leaders, so rating themselves versus other leaders in their organization. And we asked them to rate the extent of engagement on a 5-point Likert scale, with 1 being not at all, to 5 being that they engaged in these practices very frequently on a daily or multiple times per day basis. So what we saw on average during wave 1 is that emerging leaders rated themselves 3.73 out of 5, so at the bottom of the screen there, compared to a rating of 3.44 for other leaders in their organization on average. This was not statistically, there was no statistically significant difference between the average scoring, but when we looked at the specific activities that were associated with each of these functions, we did notice that there was 3 that were statistically significant. Specifically, we saw a difference in acknowledging fears and providing reassurance, which is related to the first function that Wendy discussed. And we also saw statistically significant differences in self-care. So specifically in managing individual health and role modeling good self-care, and checking in and encouraging others to practice good self-care, with emerging leaders rating themselves higher on these practices compared to other leaders. During wave 2, so next slide, we had a slightly lower response rate at 22%. And we had the majority of respondents from the health administration program. 40% were working again in management, while 20% of respondents were working in a director role. And similarly, we had a large majority of the respondents working in the acute care hospital setting and 10% working in government ministry or agency. So what we saw here, so same 5-point Likert scale, asking the emerging leaders to rate themselves again on the extent of engagement in these practices and rate other leaders in their organization. So on average, during wave 2 of our survey, emerging leaders scored themselves a 3.04 out of 5, and other leaders in their organization, they scored a 3.31 out of 5. When we looked closely at each of the individual activities associated with the 4 functions, there were no statistically significant differences in how they rated themselves versus others. Now, we were also interested to look at any trends over time. So specifically, what we did is look at how emerging leaders rated themselves in wave 1 of the pandemic compared to how they rated themselves in wave 2 of the pandemic. And so on the next slide, we'll see that the blue bar graphs here represent their scores during wave 1, so how they rated themselves, and their scores during wave 2 of our survey in the gray bar graphs. And what we noticed here, interestingly, is that on average, emerging leaders rated themselves higher during wave 1, and this was statistically significant difference. So at 3.74 compared to 3.04 in wave 2. And specifically, when we looked at the activities associated with the functions, there were 2 that were statistically significant. So specifically in creating or engaging with external coalitions to complete the work, and also identifying opportunities and encouraging experimentation and learning. In a similar manner, we also looked at how emerging leaders scored other leaders in their organization over time, from wave 1 to wave 2. So the red bar graphs here represent the scores from wave 1 of the survey, and the gray bar graphs represent their scores from wave 2 of the survey. So as we can see, on average, emerging leaders rated other leaders in their organization a 3.44 out of 5 during wave 1, and this went down to just 3.31 during wave 2. So a slight decrease in the average score. When we looked specifically at the activities associated with the function, there were no significant differences from wave 1 to wave 2. So we also, as I mentioned, asked about barriers and enablers to engagement in these practices, as well as any advice that emerging leaders had for how to operationalize these practices in their day-to-day role. And the major barriers that came out, the most common barriers included heavy workloads, communication issues, and some operational issues. While the main enablers were a culture that emphasizes open communication, collaboration, having trust within a team prior to the crisis onset, as well as self-care. And I want to leave you with a quote here from one of our emerging leaders that says, "Embrace the unknown, expect the unexpected, never feel alone, remain humble. Reach out and support one another across the organization, hierarchical and artificial boundaries. And remember, we all have a stake in this and have a role to play. Seek partnerships, including unconventional ones. These are unconventional times." And with that, I'll hand it over to Dr. Dubinsky to share some key observations and reflections.
Thank you, Wendy and Arlinda. And so going forward and looking to the future, what are some of the key observations and implications and reflections of the work we've done? If I could have the next slide, please. If we look at the observations by emerging leaders of how established leaders perform the 4 functions, one of the things that we would recommend is that established leaders need to increase the frequency of giving reassurance and acknowledging fears. But of course, the question arises, well, how can that happen? It can happen in a variety of ways. It can happen in town hall meetings. It can happen in blast emails. It can happen in on-site visits from leading administrators in any organization reaching out to their staff in their place of work, whether that's in the ward or at their desk or in by individual meetings with people by Zoom. It provides opportunities for established leaders to role model and practice good self-care, which means not just taking the time for rest and exercise and family, but also means letting others in the organization know that that's what you're doing and encouraging them to do the same thing. It means that established leaders need to check in and monitor the emotional health and self-care of others more frequently. And that kind of activity can easily take place, for instance, during these personal visits that I alluded to earlier on this slide. If we move on to the next slide, what are some of the organizational enablers identified by emerging leaders for successful crisis leadership? They certainly portend an opportunity, an important opportunity, to create a solid foundational culture that's based on open, honest communication, collaboration, and trust, or as Wendy is fond of saying, culture eats strategy. It means that established leaders should embrace distributed leadership, finding opportunities for frontline staff as well as management staff to take leading roles and to self-organize and to experiment. And if we look at the literature around organizations that are most successful in recruiting and retaining staff, they include characteristics like democratized, that is not to say democratic, but democratized models of decision-making, consensual decision-making, collaborative workplaces, transparent decision-making. So this is an opportunity to reinforce what we already know are good leadership practices in terms of maintaining organizational culture and an organization which is viewed internally and externally as a good place to work. And of course, they include maintaining a self-care practice and a work environment focused on health and safety in its broadest sense. What are some of the implications then for leadership practices of emerging leaders? One is we would encourage all of you to monitor your work hours and make self-care a priority, which may mean learning at times how to say no. It means learning how to listen more deeply, and I might add, not just deeply, but empathically, and focusing on 360-degree communication with teams. And those can be teams not just in, but also outside your organization, or teams across your organization, not just your own. It portends an opportunity to develop, delegate, and distribute leadership within teams. And if we look at the literature around teams and optimizing team function, this reflects many of the principles that you will find articulated in that literature. And it means last, but by no means least, even in times of crisis, it is an opportunity to learn to reframe and to look for opportunities for growth, for learning, and for mentorship, which is not just personal growth, but can be team growth and organizational growth. And one of the ways this can best be achieved is by enhancing the communication between and among our teams, with peers, with colleagues, with our mentors, and with our role models. Fortunately, we are now moving out of the crisis phase and increasingly aware of the fact that we are now in what might be termed the recovery phase. And if we could just go back one slide, sorry, forward a slide. The slide that says bridging the gap, there we go. So as we begin to bridge the gap and move into the recovery phase, what are some areas in which we can focus? Well, we can certainly begin to look for opportunities to create new meaning for the future, meaning for the work we do, meaning for our organization, meaning for our teams, meaning for ourselves. It's a chance at last to take a deep breath and slow the pace down. It's a chance to begin to ask the questions that will inform our future. What have we learned? What can we do better? What can we do differently? It's an opportunity to listen and to sense, to reach out to others and express gratitude and appreciation, and to do that often. It's an opportunity to begin to talk about the lessons we've learned and where we will go from here. It's an opportunity to perhaps find a time to reward people with a little bit more time off, to give them a chance to reflect and to heal from the stress that the crisis they've been through. And last but not least, it's an opportunity to assess the people in our team, the people in our organization, and say, now that I've seen how my friends, my colleagues, my peers, the people who report to me have performed in this most difficult of times, what are the opportunities that I can offer them in the future to reward them for their contribution and to reflect the kind of performance that I've seen them engage in for the last year? So how can we do that specifically? Here's some ways that we can encourage emerging leaders to engage in post-traumatic growth, or those of you who are established leaders to provide opportunities for the emerging leaders in your organization to grow in the post-traumatic phase. And if you look at these, you'll find a remarkable reflection of the strategies that we might also recommend for stress and burnout. So explore new possibilities within healthcare. There are clearly going to be people who will shift their role within an organization based on what they've learned and the skills they've demonstrated. But this is also an opportunity to look more broadly at opportunities, for instance, to engage in clinical process redesign, to look more critically at our entire primary care system, to reflect on our models of care for the elderly, because there are myriad opportunities for change and new possibilities in healthcare. It's an opportunity to pursue educational opportunities, education not just for ourselves, but for our team and for our entire organization. And those opportunities can be both professional and non-professionally based educational opportunities. It's certainly a time to begin to engage in deep self-reflection. And because of the stress that we've all been under, it's important that we take a time now to participate in self-disclosure to others. That may be within the context of our family relationships. It may be with psychologists or psychiatrists. It may be in our circle of friends, or it may be within our work groups or teams. And it's a chance to forge or deepen relationships. And if we were going to summarize the likelihood of our being successful, if we could go back one slide, well, this may sound or seem daunting or difficult or problematic. We always think we can't until we can. Don't doubt yourself. You're ready to take on and face these challenges, and you are not alone. That's a quote from one of our emerging health leaders, and I think it's an excellent summary of the opportunities for all of us to emerge from this crisis and be better leaders in the future. Back to Wendy.
So thank you, Isra or Linda. It's really now a handoff to Jennifer for questions and answers. So if you have any questions, please put them in the chat over the next few minutes. But more importantly than the handoff in this hour is a handoff to you as our emerging leaders. And I know that not everyone here is an emerging leader. There are some folks that have been in the system for a long time and some faculty. But why we think this topic is so important is that really we are in a handoff period, and it is an opportunity for you to step into your power, into your voice, and into the roles that you can play to guide our health system into the future. So I think that's the end of our slideshow, and I'll just turn it over to Jennifer to see if we have any questions at all and to get the conversation started.
Thanks, Wendy. And thank you all so much for a fantastic and insightful presentation. From the comments, it appears there's definitely a lot of resonance, and it was lovely to see we have quite a few alumni from the Vernissage program here. We had a few reunions going on in the chat, which were lovely. So I will start by reading a comment from Paul Miller, which is really insightful, and I think we can build on it. Paul says, crisis is by definition usually overwhelming. I think a key critical function that we didn't do well enough was setting priorities. There was too much to do. Caring for emotions is important, but so too is prevention of burnout by not carefully managing and preventing the overwhelm. So what I would ask our panelists, whoever wants to take this first, do you feel that there's a priority or a ranking is it to the order of these criteria of leadership? Is there one builds off the other, or can they all happen together? And the other thing I would ask is, do you think that there are certain contexts that perhaps enable one versus the other? So for instance, in an organization that already has a strong open culture, perhaps you can jump right into the experimentation phase. So I'll let one of you field that open question.
Hmm. I'll take a little stab at it. I think part of leadership is and complexity theory is to be able to handle things as they come to you. But if I were to look at those four functions and set some priority, probably the first is addressing the fears that occur and putting out there what is known and what is not known. And of course, when we're, in wave one, there was a lot of things we didn't know. And people can't focus, they can't jump into new roles, and they can't organize their work or experiment until I think some of their fears are addressed. So that would probably be, and that's a constant job, I think, throughout, because fears change, right? But to me, that would be priority one and an enabler to some of the other activities as well. I don't know what my other colleagues would have, or if you want
Sure,
to jump to another one.
I can
Yeah.
add. So I think, Jennifer, to your question, in terms of do things like maybe prior trust within a team contribute to make one of these functions easier to implement? So I definitely think, for example, when we're talking about encouraging experimentation, that if there is a trust before a crisis onset, that perhaps leaders and staff are more willing to jump right in and trust that process. And I would imagine that perhaps if there wasn't that type of trust or open communication within a team, that maybe that function would be a little bit more difficult for staff to get on board and for leaders to engage with.
And I'm going to take a slightly different perspective, perhaps, which is to say that you cannot pick up a journal, whether it's a medical journal, a nursing journal, a management journal, or for that matter, even read the lay press these days, without being forced to recognize that healthcare providers work in an environment where stress is high and burnout rates are high long before the COVID crisis struck. And so I think this is an opportunity to say and reflect on the fact that coping with a crisis becomes much more difficult when you're expecting individuals who are already experiencing high levels of stress and burnout to take on incremental roles and make difficult decisions in a short time frame. So if I was going to say any one thing, it would be, what can we do as organizations to diminish that baseline stress and burnout? Because I think that will significantly increase our capacity to deal with stressful situations.
Thank you all. Really, really helpful insights. So Paul just chimed in with another question, but first I will read a question that came in from Malcolm Moffat. So Malcolm asks the panel, sometimes the culture created by senior leadership stalls the appropriate response to a crisis. What advice would you give to emerging leaders to help them influence their senior leaders to change the culture so it's more able to deal with the crisis?
Who wants to take a stab at that? I'll maybe say a few things. Um, Three things that really come to my mind that I think about is, first of all, you thinking about yourself, you being the role model and the type of leader that you want to see, and the culture that you want to be part of. And so role modeling yourself, the type of culture, and that requires some self awareness. Sometimes we tend to rate our own practices, as we saw here, a little more highly than others might see us. So be your best leader. Um, and I think, you know, cultures evolve over time, and there is sometimes a tendency to be critical of a culture, not saying that it's also not warranted, but beginning to look at your culture and practice empathic leadership and listen and observe why the culture is the way it is and try to walk in the shoes of um, the folks around you and what are maybe some of the root causes. And I think once you've looked at yourself and other people, then, start with small changes in your area. Crisis, you could probably introduce some bigger changes. Do that yourself, link arms with other trusted colleagues within your organization or across the system. Suggest new approaches. And, a crisis is a great time to try them and start to show the results, a different way of doing things in an open and non-critical manner. So those are, I guess, three things I would think about. Look at yourself, try to understand others, and then start the change yourself.
And as Wendy said in the introduction, I spent 15 years in the world of consulting. And one of the things I came to realize very quickly is that the art of consulting is taking all the things that people in an organization had already said to somebody else that weren't paid attention to and rephrasing them. So I think part of it is a learning exercise for emerging leaders. How can I say what it is I want to say in a way that conveys the message that's seen as contributory, as helpful, as collegial, as opposed to being confrontational or demanding? Part of it is also helping people in an organization develop a model. There are many models, there's no one that's better than another, but a model in which people are encouraged to speak up and advocate for change and allowed to experiment, partly by the way you say it, but also partly by volunteering to take the lead. So I'm not just telling you what I want to have happen, I am volunteering to facilitate the process.
I'd be interested, Jennifer, you and Arlinda research and have an interest in leadership. Do you have any thoughts on that question? How, as as an emerging leader, you might begin to change a culture that you might find, maladaptive or not optimal?
I'm happy to defer to Arlinda first.
I was going to say one of the things that came to mind is this idea that you don't need formal leadership title to consider yourself a leader. And I think oftentimes, myself included, I often think that I do not have the skills or I cannot step up to the plate without having that formal leadership title. So I think it's important to recognize that that we have a lot of skills that we've built both through our training at IHPME and Rotman and within our work experiences, and to utilize that and to sort of get away from this imposter syndrome where we think that we're not good enough. And so I think from my perspective, having mentorship is one key thing that could support that process, and having perhaps a management or leadership that believes in you and gives you that opportunity, even if you do not have, for example, formal leadership training. So that's just my 2 cents.
And in my experience, I would say I really felt the embodiment of so much of what the research has shown over the last year, by which I mean, it's true what's been said today, that the crisis has brought opportunity. And for me, the specific opportunity was realizing that everyone was just desperate for connection and desperate to keep relationships. And it allowed an opportunity to connect with people as humans first, and putting aside a little bit of the hierarchy, which is something that isn't always possible and feasible. And just by developing those more organic relationships and sharing, you also understand what are the stressors in someone's professional life? Where can you contribute? Where can you take on a more active role that otherwise wouldn't have been visible to you? And so while this isn't always natural, certainly isn't the normal way of things happening in very hierarchical organizations, I would assume I'm probably not the only one who had this experience of more organic. I would say that really was the emulation of the post-traumatic growth.
Mhm. Right.
So, and I think that actually segues quite nicely into a follow-up question that Paul asked, which is an important counter to this idea of the post-traumatic growth. And Paul asks, how do we acknowledge that this post-traumatic growth also requires acknowledgement of the trauma? I have been injured, I have been harmed, my passion has hurt me, are not comments that are commonly made and often expose vulnerability we are not comfortable with. So I can say I was someone who was fortunate to be with people who were open to having those conversations, but that's not always the case.
Mhm. I wish we could give Paul the mic so that he could participate in that. Those are excellent questions. I mean, that's what whether you're in crisis or not, but particularly, after trauma, after we've been through and are going through something like this, having, and Isra mentioned them in one of his slides, having the safe space, the ability to disclose, is so important. And I know that's a core of Vernissage Health, is getting our emerging leaders, one, comfortable and able to share authentically, and able for themselves to create that safe space within their own organizations and their own teams. And that doesn't exist everywhere, but somehow, there is a friend, or there's an ally, or there's a colleague. You've talked about it, Jennifer, where hopefully you can disclose safely and you can talk and you can heal. And it's going to take time. Um, and I think we need to be easy on ourselves as we hopefully move into recovery. Um, so those would be a couple of my thoughts. And I don't know if anybody else wanted to come in. That's not how we work usually, especially when I was in healthcare. We all wore our suits of armor to work, right? We were taught not to disclose. We were taught to look the hero, right? Keep a stiff upper lip, all of those things. So that's how I was kind of trained. Those were the leadership role models that I saw. I hope that you all and folks now are demonstrating a different type of leadership. Um, Vulnerability, this is it is a strength. It's not a weakness. Showing that you're vulnerable and that you have emotion is a strength. And it's hard to do. It's really hard to do.
And I would add two things. One is, what can we do currently? I think this is not the right role for employee assistance programs or other such things. I think this is a time for organizations to look for opportunities to bring people together in an environment that's confidential, to which people are facilitated and encouraged to attend, but not forced to attend, and to capitalize on opportunities to bring in professional staff to help groups, teams, and individuals get over this crisis. Whether that's psychologists, social workers, psychiatrists, I don't think it should be somebody who's part of the team. It needs to be a skilled professional from the outside. And on a go forward basis, to perhaps amplify what Wendy has said, we all read a lot these days about empathic leadership. And this is an opportunity for us as leaders, or for those of us who are aspiring or emerging leaders, to say, how can I model my leadership style to be more empathic so that people understand that I do feel what they feel and that I am willing to actually share with them some of what I have gone through so that we get this sense that this is truly a shared experience.
Thank you both. Wendy, sorry, just in the interest of time, I'm going to move on to the next question because we have a couple more coming in and I want to make sure that we have a chance to discuss them. So Anshul Krishna has a really insightful and I think important question. Anshul says, a year ago, many of us were quickly able to prepare for a sprint that was the beginning of the crisis. And it turns out we're in a marathon or perhaps a triathlon as we think about how we need to navigate up, down, and sideways based on what is happening in the environment. Any insights on how we can shift our thinking and strategies as leaders to focus on this longer race we're in and lead our teams? And I think we've just started on this conversation a little bit, but please feel free to add in any thoughts.
Mhm.
I can maybe start. I think one key thing is this idea of distributed leadership that we talked about. And that's where the opportunity lies here when we're in a marathon or a triathlon. This idea that everybody has a chance to step up to the plate and to distribute, not only the opportunity of leadership, but the burden of leadership, because it does come with a lot of responsibility. So certainly I can see that being an opportunity for moving forward and trying to finish this marathon or triathlon.
And let me say, notwithstanding the fact that we're talking about triathlons, this isn't a sprint, it's a long distance race. And part of that, and this reveals my background as an emerge physician, so I apologize for that, is triage. Every organization, every group, every team will have felt the impact of what we've been through differently. They will have different priorities, they will have different needs. So I think it's important to be sensitive to the milieu in which you work, to say, what are our priorities? What are the things that have most affected this particular group? And let's develop a strategy that reflects what our needs are in this moment. What are the urgent ones? What are the less urgent ones?
And I'm going to say one little thing, jump in. Hi, Anshul. Thank you for the question. I think for women here, we're carrying a huge burden at our work, and we're carrying a huge burden at home. Isra said it, but not expecting being too much of ourselves, and being kind to ourselves, and we just can't do it all, and just that's okay. And I loved what our Linda said, is that we don't have to do it all. And I think as a woman, I sometimes do try, because that's again how we're kind of acculturated, if that's a word. But it's okay to hand off. And it's and drop a few balls. You don't, it's not the time to be perfect.
I love there's a great phrase. Do you want it perfect, or do you want to get it done?
Mm-hmm. Very appropriate for right now. So questions are coming in. We'll do my best to get to all of them. Andrea Gershon asks, when does one come out of crisis mode? When does one accept that there is a new normal? And I'm sure everyone will have their own answer to this question, but what are your thoughts?
You know what? I'm going to tell you, answer the same way as I've answered everybody who phones me all the time saying or asking a similar question, which is, all we can offer is opinions. There are not enough facts. And no matter what anybody tells you, they're giving you an opinion. I think that there is a huge sigh of relief that's national in function now as people realize immunizations are going to roll out. We are going to be a lot safer. But I also have learned in my own life, professionally and personally, that the crisis doesn't end just because we think it did or because we wish it did. There are going to be lasting impacts that will last for months and years, and for some of us, perhaps even for a lifetime. And we just have to be open to that possibility and reach out to friends, to family, to professional therapists, because we are all going to need help in the long term, not just the short term.
Thank you so much for that, Izzy. And I could not agree more. I think you've really just said it perfectly. And I want to add, before I get to the next question, Evelyn Williams makes a really important point. She says, to Wendy's point about not doing it all, it is important to give up on being perfect in self-care as well. I think we've all been told, especially a lot of the solutions are mindfulness, yoga, meditation, and even that takes time and energy and effort. Sometimes it's okay to just tune out and go into survival mode.
You got it.
This is our permission to the audience today to do what you need to do to get through this.
Yeah, if there's a day or two you don't exercise or you eat or whatever, do what you got to do.
Mm-hmm. Yes. Okay, next question. Anne-Marie Menka Gyamfi. Anne-Marie asks, as the pandemic continues, how do we spread this information to leaders to help them utilize these recommendations in their role? Many workers presently and will continue to require the support in their work environment. Great question. Really great. I see Wendy nodding emphatically. So do you want to start us off?
Well, yes, I do. Well, the first thing is we're here to talk to you. So, we're very interested in how you're receiving this. So please do the survey so we kind of get some feedback from you. Second of all, we have written this up where I don't want to, we're hoping this is a journal article. We're just going through the revision process. So we want to get this information out there. And yeah, I mean, Izzer and I were just not too long ago asked to kind of take this out to an organization and to others. So you take it out, and the article will be there. And those are, some initial thoughts that I had, but we need to talk to the established leaders as well. Yeah. Linda, what do you think?
I was just going to add that a program like Vernissage Health presents a really good opportunity here because it includes not only emerging leaders, but established leaders. So that's sort of a key program we can utilize to disseminate what we've learned for leadership during crisis. And I believe, Wendy, in this past year, you also did tailor some of the sessions to leadership during crisis.
Yeah.
So that's certainly another avenue that we can utilize and target both emerging and established leaders.
And this is a bit of an off-the-wall comment, but Wendy started by introducing the lessons learned from SARS and David Naylor's report. And it's fascinating how much was in that report that was not adopted and not acted on and not implemented. And we got a second chance here, folks. And it's not often that you get a second chance. It's time to not just reflect on what we've heard. It's a call to action.
Very well said. So we have just under 5 minutes left. So I'm sure there's lots more we can say, but since we have a hard cutoff at 5:30, what I'll instead ask our panelists, if there's one thing, one takeaway that you want our audience to know, whether you've had a chance to share it and reemphasize it, or we haven't had a chance to cover it yet, what's your parting words for our audience today?
Well, in less than 5 minutes, I would say, summarize some of the things we've talked about. Take good care. Be open about what's happening. Communicate to your friends, your family. We're in this together. So speak about your needs and listen to the needs of others. And I would say be brave, be courageous. And and really embrace the opportunities that this crisis presents. I really hope people go into long-term care and care of the seniors and other areas. I love the conversation around equity, diversity, what's happening in our communities. I just hope that we all jump in and make changes and put our shoulder to the wheel to change what this crisis has exposed for all of us.
And since Wendy said almost everything I was going to say, I'm going to give a different answer than the one I was going to give. So much of what we do in healthcare is reactive. We're reacting to crises, we're reacting to budget shortfalls, we're reacting to human resource issues. And my plea is, let's move to be proactive. Let's look at a future that we want. Let's articulate that future. Let's build systems and clinical service plans and human resource plans and safety plans that are focused on where we want to be in the future as opposed to where we've been in the past.
And my key takeaways that I wanted to share kind of go both, build on Wendy's and Izer's comments around taking the opportunities. So as an emerging leader myself, looking for that opportunity and taking it, not being afraid, knowing that I have a lot to learn, but recognizing when there is an opportunity and giving myself the credit that I can totally do it and I can take this on. And I would encourage everybody out there to believe in themselves, and you'd be surprised at what you can accomplish.
Fantastic. Thank you all so much. Wendy, I'll pass it off to you to bring us home.
Okay, well, thank you, Jennifer. That was wonderful. You did just a phenomenal job. And thanks for everybody for the comments. And, you know, I see the chats going. So thank you for your excellent comments and participation. Please take a couple of minutes and do the survey. We haven't done this. This is really the first time we've this group has kind of come out there and put something forward. So we really are interested in where you might guide us with this. So have a wonderful evening. We'll end on time. And thanks to all of our friends and colleagues for joining us. Take care. Thanks, Arlinda. Thanks, Izer. And again, thanks, Jennifer. And Alisa as well, who's behind the scenes driving the car. Really, really appreciate all your support. Take care.
Good night.